we are now, we have faced a lot of improvements in multiple myeloma with many novel drugs that have been approved. In fact, we have 14 novel drugs approved in the last century for multiple myeloma. The century in which we are, in the last 20 years. But we are now seeing more other drugs or combinations or drugs or no other mechanisms that are coming into the scenario of multiple myeloma. Here we can speak about, for instance, the novel CELMoDs, novel IMiDs, such as iberdomide or CC-92480. We have seen the Selinexor, for instance, that is already approved. We have seen also Melflufen that is already also approved for multiple myeloma in the FDA. And also we have even the immunotherapy, such as Belantamab, or ADC, the targeted agents such as Belantamab, and other ones such as the bispecifics. We have seen the activity of all these, it's as monotherapy, and particularly in very heavily pretreated patients with 30-40% response rate that lasted for 4-6 months, even up to 8 months, and even more could be for some bispecific or in CAR-T, but we are still early to say that. But now the field is going to combining all these novel agents, these novel mechanisms. We are moving them forward, and the initial relapses, even newly diagnosed, but first relapses, and even in combination. And we are seeing many of these agents exploring combination with pomalidomide, with bortezomib, with daratumumab. I'm not speaking about each of them separately, but the general point is that they are feasible to be combined, that they have a good safety profile, nothing emerged as something important, and also I think it's quite effective. So I think we have to wait, but probably in the future we will see all these novel drugs and mechanisms and targets coming more into the clinical scenario of multiple myeloma in different combinations.